This prezi presentation is to discuss the findings of the Inclusion and Autism study. Paraprofessionals and other students was a common answer throughout the questionnaire. Many teachers stated that they relied on paraprofessionals and regular education students to help students with autism, whether that meant including them, making accommodations, or handling disruptive behavior. I myself rely on these individuals as well. When a student has completed a sewing project early, I often pair them with a student with autism in order to help the student finish the project on time. I also rely heavily on the para to help students with ASD work through the projects. My questions are, between a paraprofessional and special area teacher, who is responsible? If a student gets hurt when working with equipment, but a paraprofessional was working with them at the time, who is held accountable? I also wonder whether these two groups are relied on too much. Paras receive little training besides a handful of workshop days during the summer, and yet a lot of responsibility is placed on their shoulders. Regular education students have their own projects and studies to worry about, but teachers seem to be constantly relying on them for help. I believe that if we had more trained paras in the room, regular education students would not have to be called upon as often, and the main teacher would have more time to help students. Two more themes amongst the questionnaire was the use of therapists and students with autism struggling to use fine motor skills. In a hands-on classroom, fine motor skills are extremely important. It sounds as if teachers are figuring out how to make accommodations so the student can participate and complete the project on their own. Many of the special education teachers listed therapists as a resource, but none of the special area teachers did. Why are special area teachers not in close contact with therapists? The therapist might already be familiar with the student and their abilities, making the process of figuring out adaptations and modifications easier. Why are students pulled out of the classroom for occupational or physical therapy when the therapist could work on a child's skills in class on a curriculum-based project? Prior to implementing this research project, I spent some time looking for research articles about special area classrooms and autism. The process was challenging because there was only one article whose main focus was special areas and autism. This is interesting because most students throughout the United States will attend special area classes such as art and music. The other articles used for the study may have only contained one point throughout the entire article that was relevant. Why is there a lack of research-based studies about including students with autism in special area classrooms? These classes present unique situations, equipment, and hands-on projects that may not occur in a regular education classroom. Special area teachers can look to teacher blogs and websites for information, but they are not research-based. Modifications are made in the classroom, but they are also included in the individualized education plans where they are known as specially designed instruction. In my experience, I, as a special area teacher, am typically only asked to attend IEP meetings because the case manager needs a regular education teacher for a student who is only in self-contained classrooms. Special area teachers should be included in the IEP meetings in order to create SDIs that will help the student in their classroom. Each modification lists where it should be applied, often being either the regular education classroom or a special education classroom. In my years of experience, I have yet to come across a modification that is for the special area classroom. Many of the regular education modifications can be applied to a special area classroom, but these classes often present situations that are unique and could benefit from specific modifications thought out ahead of time. Prior to reading through all of the responses, I created a chart in order to compare the facts from the literature review with teacher responses. When a teacher statement resembled one of the facts, I recorded it. Of the 16 overall facts, teachers made similar statements for 10 of them. A majority of these statements were made by special education teachers. Special area teachers seem to be at a disadvantage. They have received less training and do not feel as supported from their district to work with this population compared to special education teachers. I graduated from college in 2011 and was not required to take any special education courses, but teachers graduating in 2013 were required to take one special education class. At this point, special education teachers appear to have more tools and knowledge to draw from. It would be beneficial for special area teachers to possess the same skill sets.